This presentation is based on one of my earlier publications, Effective Tools of Pharma Counseling. Statistical data shows approximately 16% of patients admitted to hospitals are based on adverse drug reactions. Welcome to my channel. I'm Dr. Vinod, a pharma academician by profession. Approximately 50% of elderly fail to get full potential of their medications, mainly because they are not restricted to the correct way of drug therapy. There could be alcohol consumption, maybe smoking, lack of exercise, or dietary restrictions. Inappropriate use of medicines is called non-compliance. To know better, we should know the difference between bioavailability and therapeutic index. Bioavailability, by definition, is the rate and extent to which the drug has been present in the systemic circulation, that is the bloodstream. And therapeutic index, we should know the graphical representation of the drug plasma concentration versus time. Here you can see as the drug has been administered, it slowly gets into the systemic circulation and it reaches its maximum. Then slowly it comes down as the body eliminates the drug from your system. So naturally, there should be a minimum therapeutic concentration below which there is no pharmacological action initiated. And also, there should be a maximum plasma concentration permitted, above which, if the drug level has risen, it reaches to the toxicity. The toxic level, it reaches, precipitates the toxicity of the particular drug. So, for every drug, there is a small window, and this particular window varies from drug to drug, where the effective drug concentration is permitted within the safety level. That particular window is called therapeutic window, otherwise known as therapeutic index. Most of the drugs what we are consuming should be taken after food, mainly to reduce the irritation of the stomach. But there are few drugs which have to be exclusively taken before food to have its full potential. For example, anti-ulcer drugs. Ulcer is caused by the excess secretion of hydrochloric acid into the stomach. The purpose of hydrochloric acid is to neutralize the bacteria and other substances, toxic substances, which we are consuming along with our food. But at the same time, this same hydrochloric acid, if the concentration is more, it irritates within the gastric mucosa, causing wounds and ulcers, which we call ulcer of the stomach or even duodenum. So there should be some drugs which should prevent the secretion, the excess secretion of this particular hydrochloric acid. And those drugs examples you can see here, omeprazole, esomeprazole, lansoprazole and pantoprazole, all are proton pump inhibitors. It's a specific mechanism by which the HCl has been checked, restricted in secreting in excess. And also there are few H2 receptor antagonistic drugs like ranitidine, famotidine and cimetidine, which again restricts the excess flow of hydrochloric acid. But if there is a heartburn, if the stomach is having a burning sensation, immediately there should be a drug should be taken after food. You can go for antacids. So naturally antacids we can take after food or whenever there is an heartburn for you. Otherwise all these drugs should be taken at least half an hour before food. If a patient comes with stomach pain and vomiting or vomiting sensation, nausea, best drug is domperidone, should be taken before food. Only vomiting or nausea, then definitely metoclopramide is the drug of choice, should be taken before food, maybe half an hour. Having spasmodic pains, stomach pain, or maybe motion sickness, usually the drug of choice is scopolamine, otherwise known as N-hyoscine. Meborin also is a wonderful drug, but these drugs should be taken half an hour before food to reach its maximum potential. Like pizotifin, yes, before food is ideal. For allergic drugs, we used to give antihistamines. Meclizine is a drug which should be taken half an hour before. Of the diabetic patients, the prescription goes for before food, but definitely there are a few exceptional cases. So a physician's intervention is required in this particular case of anti-diabetic drugs. Amiloride should be taken before food, but make sure it's not taken just before sleep because it disturbs your sleep. Antimicrobial azithromycin should be taken half an hour before food. Perhaps this is the only one antibiotic should be taken before food. Thyroidism, the drug of choice is thyroxine, sodium. Usually we say the day starts with thyroxine. So we have to take all these drugs before food to have its full. Thank you so much for watching my video. Stay healthy, stay connected.